If you can invite 3 people for dinner, who would they be? You can't name family members. Huh? This video is a plea to those people on interview panels, whether you be on a doctor interview panel or any other interview panel. Please stop asking stupid questions. Hello, I'm Dr. Anthony Llewellyn. I help you manage your career right here on YouTube. So one of the ways that we try and help other doctors through the channel and my blog site and website is I have collected an open bank of real interview questions. These are questions that have been asked in a formal doctor interview process. Our community members regularly submit questions to this bank. Thanks heaps, by the way. And they're a really valuable source for helping you to practice for interviews that are coming up. So we've got them categorized in a number of specialties and just non-specific, etc. So you can have a look through them and use them for your interview prep. Now, not infrequently, what I tend to find is that the questions that get submitted through this portal raise a bit of an eyebrow for me. And I do wonder whether in fact we are providing a bit of a service to anonymously out dumb, stupid, just plain weird interview questions, and I guess by proxy, those people that come up with them. So here's this recent example from a pathology trainee interview. If you can invite 3 people for dinner, who would they be? You can't name family members. So what exactly is wrong with this type of question, and what makes it a dumb interview question? Well, whilst I have no issue with coming up with a challenging question for the job interview, the question itself does still have to make sense. And it does need to allow the candidate to provide an answer that helps you as the interview panel to judge that candidate by the selection criteria that you've set out for. Otherwise, it's just unfair and it's a waste of time, really. Everything is contextual in recruitment. A question about inviting guests to dinner might very well be relevant for, say, an event management position where one of the key result areas is the ability to come up with, say, a fresh program of speakers for your event sponsor. That's a perfectly fine question for that scenario. But the selection criteria for most medical jobs that I've seen don't include an event management function. They generally talk about behaviors such as demonstrating good clinical knowledge and skills, good communication, good teamwork, being professional, demonstrating ongoing learning, and practicing cultural respect and safety. Maybe, just maybe at a real stretch, a question about inviting people to dinner could infer something about maybe how one goes about forming a team. But I can think of a dozen better ways of constructing a question that gets to that particular issue. Unfortunately, sometimes doctors who attend interview panels in medicine think that because they are intelligent people and perhaps they've attended a one-day course in recruitment and selection, that they're all of a sudden an expert in human resources and recruitment, and that it's time for some wacky interview question to challenge the candidates. Perhaps they may also feel that a creative thinking type of question might give them a different perspective on the candidate. I guess some sort of useful insight into their personality or communication or teamwork style. But guess what? There are actual validated psychometric, employment and other psychological tests that do a much better job of this than one interview question that has not been calibrated at all. So I'd encourage all doctors and other professionals involved in the candidate selection process to stick to the script. By which I mean stick to the principle that each interview question should form a relationship to at least one of the selection criteria for the job. I say this for a few key reasons. Firstly, this principle actually makes it easier to design good questions and establish a rating criteria. Secondly, the information you gain from questions that are done this way from each candidate will be far more useful to you in the end. And thirdly, most importantly, you're also avoiding getting into the tricky area of problems with discrimination and equal employment opportunity. Yes, that's right. If you can't prove how your selection process relates to the actual requirements of the job, then you open yourself up to the possibility of candidates challenging the process as being unfair. Okay, so you've looked at a list of questions for the job that you're running and you've decided that they're quite predictable, which is often the case in medicine, and maybe even the same as last year. And you'd still like to be able to stretch the candidates a bit and be a bit more discriminatory. What can you do? Well, Here are a couple of questions that you can probably use in your next medical job interview, bearing in mind that you still do need to ensure that they actually line up with your actual selection criteria. So the first good interview question comes courtesy of Lou Adler, an expert in this area. And he suggests that a good question to ask of job candidates is something like this. What single project or task would you consider your most important career accomplishment to date? Wow. This one question can just tell you a whole lot about a job candidate in medicine and other fields, really. And it just invites a whole bunch of supplementary questions depending on what their answers are. It can start out with whether they actually value outcomes and achievements in their work at all. It can also provide insights into how they go about accomplishing success, how they manage their time and incorporate feedback into their process, whether they get chosen to work on challenges at all and why, and who chooses them, and how they work with others to marshal resources and create a common cause and call to action. There are just so many add-on questions that can be explored off the back of this one single question and answer. And this question is so easily related to the selection criteria of most medical jobs. For example, demonstrated ability to work effectively and harmoniously in a multidisciplinary team. Demonstrated good organisational time management and problem solving skills within a complex clinical environment. Proven commitment to ongoing learning and professional development. Ability to contribute to quality and improvement and or the clinical safety in the hospital. 4 selection criteria I just pulled straight off the web from job positions going in medicine in Australia right now. And here's the second approach. Here's another question. It's actually not really a question, it's a test. And the question starts with something like, could you demonstrate to us the following? And then you actually give the candidate a test. And that test will again depend on the position and the selection criteria. In the majority of jobs in medicine, there's normally a key task that is so important for the role and which can also be simulated in an interview environment. A successful demonstration of this task will normally address selection criteria around things like clinical capability as well as often communication skills. The skills test is used surprisingly sparingly in medical job interviews in my experience, but it's often very easy to deploy and quite useful. Here's an example. In a past role, when I was recruiting doctors to fill resident medical officer posts in a mental health service, this role required a basic ability and knowledge of mental health, of course. But actually we felt and knew that we could actually teach most of that because that was our expertise. The important thing about this job is that we require the doctors to actually have up-to-date medical skills because actually patients in psychiatry often have a broad range of medical problems as well. So this is what we did. We'd give each candidate a couple of ECG readings with a scenario, and these readings demonstrated a common abnormal finding on an ECG. This task was remarkably discriminating and quite reassuring in terms of helping us to hire doctors who were able to interpret basic ECGs and also then had the basic medical skills that we needed of them. So some other examples where a skills test may be relevant could be, say, a resident demonstrating how to complete a pathology form or a prescription for a patient, a surgical trainee demonstrating a knot tying technique, surgical training consenting a member of the interview panel for a particular common surgical procedure, a radiology trainee interpreting and completing a report on a chest x-ray, a radiology trainee explaining to the neurosurgical registrar why it was that they couldn't have their urgent MRI done straight away, a psychiatry trainee watching a short video of a patient and then reporting to the panel the mental status finding, an advanced trainee being asked to give a presentation on a recent update in their field, as they often would do at, say, grand rounds, or a consultant being given a ward round list with some information about each patient and being asked to prioritise which ones should be discussed first. So my final message is this. Yes, a lot of the questions that are handed out in interviews for medicine are pretty stale and predictable, but there's plenty of advice out there and expertise from experts that can help you to develop better questions that are still targeted around the selection criteria. There's no real need to go out there and get inventive. What about you? Have you been on a panel and raised an eyebrow when someone insisted on asking a really curveball, stupid question? Or have you perhaps been an interviewee for an interview process where you've just felt that you had no idea why a particular question was asked? Well, let me know about that question in the comments below, or leave a like if you enjoyed this video, and if you're enjoying more than one, then you really should think about subscribing and turning on notifications so you can know about the regular weekly videos. I do sincerely hope that you learned something today, and I will see you in the next video.